Treatment of hydrocele. Treatment of hydrocele is only surgical. Treatment of the commonest hydrocele, which is primary vaginal hydrocele. The commonest operation and the most popular operation for primary vaginal hydrocele is operation called Lord's operation. Lord's operation is the most popular for thin wall small hydrocele. What is the technique? Incision in all layers of the scrotum. Scrotal incision, including all layers of scrotum and the parietal layer of the hydrocele. What is this? This is evacuation of the fluid. If this is the hydrocele and this is the testis, we perform a scrotal incision including all layers of the scrotum, skin, dartos, muscle, etc., and parietal layer for evacuation of the fluid. And the assistant, this is my assistant, squeeze the scrotum. If you squeeze the scrotum, the testis prolapse from the scrotum. The testis prolapse from the scrotum. What is this layer? It is the visceral layer of tunica vaginalis covering the testis. And what is this layer? This is the parietal layer of the tunica vaginalis. This is the view. This is the testis and the visceral layer in the hand of the surgeon. And this is the parietal layer of the tunica vaginalis. Then, by multiple interrupted plicating sutures, we plicate the parietal layer of the tunica vaginalis around what? The lower part of the spermatic cord. Incision in all layers of the scrotum and the parietal layer of the tunica vaginalis. Evacuate the fluid. Squeeze the scrotum by assistant. The testis prolapse, and this parietal layer of the tunica vaginalis is plicated by multiple interrupted sutures around the lower part of the spermatic cord. This is Lord's technique, which is the most popular operation for thin-walled small hydrocele. For thin-walled small hydrocele, we can also perform eversion of the tunica vaginalis. What is the eversion of the tunica vaginalis? If this is hydrocele and this is a testis, incise all layers of the scrotum and the parietal layer, evacuate the fluid, and this, which is the parietal layer, is everted and sutured behind the testis like this. This dotted line is the visceral layer of the tunica vaginalis, and after incision of the parietal layer is everted and sutured behind the testis and the epididymis. This is called the eversion of the tunica vaginalis, so that the secretion of the tunica vaginalis now released inside the scrotum, where it is absorbed by the venous drainage and the lymphatic drainage of the scrotum. Finally, subtotal excision of the tunica vaginalis. This operation, which is excision of the tunica vaginalis, is indicated in thick wall, large hydrocele. In thick walled large hydrocele, incision in the scrotum, then incision in the parietal layer of the tunica vaginalis to evacuate the fluid. Then the parietal layer of the tunica vaginalis is excised on both sides of the epididymis. This is the testis, and behind the testis is the epididymis, and the anterior to the testis is the tunica vaginalis and the hydrocele. Incision in the parietal layer evacuates the fluid. Then this parietal layer is excised on both sides of the epididymis. This is called the subtotal excision of the tunica vaginalis or hydrocelectomy. 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 Aspiration of the hydrocele. This is only a palliative measure if surgery cannot be done and recurrence is sure. Aspirate the fluid and the fluid recollect sooner or later. And during the aspiration, you may puncture the testis, leading to testicular fibrosis and testicular atrophy later on, or hemorrhage due to puncture of the testis, leading to hematocele. Introduction of infection into the hydrocele, leading to biocele. Therefore, it should be avoided as possible. Aspiration is only indicated if surgery cannot be done because it carry complications. This is the primary vaginal hydrocele. We have three operations: Lord's operation, eversion, and excision. Congenital and infantile hydrocele. Surgical treatment should be delayed in infantile and surgical and congenital hydrocele until the end of the first year of life. Treatment of this, congenital or infantile. Ask the mother and the father to wait for 1 year. Why? Because spontaneous cure may occur. How? Spontaneous cure. Obliteration of the proximal part of the processus vaginalis and the absorption of the fluid inside the tunica occur and the baby become normal. Therefore, surgical treatment should be delayed until the first year of life. If persists after the first year, we should operate. What is the operation? Divide the hydrocele, congenital or infantile, divide into proximal part treated as hernia by transfixation excision as hernial sac, and the lower part of the hydrocele is everted behind the testis and the epididymis. Treatment of incested hydrocele is incision over the swelling and the local excision. This is a treatment for hydrocele. Thank you for good listening and good luck.